Hi, this is Paul, a part-time expat, and today I'm coming to you from the Pacific coast of Costa Rica. You can see in the background the Pacific shoreline, and I'll just give you a quick 360 degrees. We've got rock formations in the back, foliage, beautiful trees, and back to the ocean and the sky, and back to our spot, 360 degrees. Hey, I'm here again with some more reasons why people choose to live part-time overseas as expats. And today we're going to look at another reason. Health is a really important concern to a lot of people. And my mom used to say to me, if you have your health, you have everything. If you have your health, you have the best in life. And a lot of people feel that way. And so health concerns are a major issue when people come to the point of deciding whether they want to live overseas part-time or not. Well, I've discovered that there are really two reasons around the health issue why people choose to live overseas part-time. The first one is that they like the health care that they're receiving in their home country. They like their doctors, they like their plan, they like the system, they feel confident with it, they feel like they're getting the care that they need and that they like. And so they want to maintain those benefits. And if you move overseas full-time and you change your residency, you will lose Medicare, Medicaid, and so forth because you're not residing full-time in the United States or in your country, whatever your home country is. So you'll need to check those laws about your health coverage benefits in your home country if it's some other country. But people want to maintain, they like their doctor and they like what's going on, and so they don't want to be gone full-time. So they choose part-time living overseas so that they can maintain those benefits. The second reason is that really some people just want the total opposite. They want a totally different health system. And so they move to a country that has a different system. Many countries have really good public health systems, and as well as really good private systems. For instance, here in Costa Rica, they have a really high quality public health system that is not only high quality, but much lower cost to the people who participate in that system. And so some people come here because they want the healthcare system. They want to be in that public healthcare system. As well, here in Costa Rica, there are some excellent private hospitals and private doctors. In my own experience, our family lived here for 11 years, back a few years, and during that 11 years I had 2 surgeries myself at 2 different private hospitals here in Costa Rica. And I have to tell you, the care and the attention and the service I got was excellent quality, just as good as I would have gotten in my home country. But I only paid about 15 to 25% of the cost I would have paid in my home country. So many people come because of those different systems that provide different benefits to them. A lot of people, they feel like in their home country, maybe medicine has become such a business that it's not quite as much a human service as it used to be. And people come to Costa Rica for medical care because they find that the human service element is still very much alive here. Let me just give you an example. Recently when I was here, I had an infection, and so I went to a private doctor here in our little town, and I got excellent care. The office call was $50 US, and then there were antibiotics I needed to have, and there were 3 injections 3 days in a row. An injection 3 days in a row. And so for the first 2 days, I went to the doctor's office. She injected me free of charge, just for the medicine. And then the 3rd day I was to have an injection was actually the day that we were supposed to leave for the airport to go back to the United States. And so this doctor came at 6 a.m. to our condo with the injection and gave me the injection at 6 a.m. So that I could get to the bus to get to the airport on time. You just don't find that much in many places, that kind of care. And when we were trying to decide, what should I do about this 3rd day of injection, it was her idea. Hey, why don't I just come? I'll come at 6 and give you the injection and you'll be on your way. pretty cool. Pretty cool. So, you know, a lot of people also come here, at least to Costa Rica, because dental care is cheaper, plastic surgery is cheaper. I know people who have come from North America here, excuse me, just to have dental care or just to have plastic surgery because of the quality and the cost. So, you know, whatever your concerns about health, or whatever your reasons, and whatever system you need to choose, whether it's staying with your home system or whether it's adopting a new system, you choose what is best for you so that you can have the best health possible. And in doing so, you'll be choosing one of those reasons why people live overseas part-time and do it successfully. Again, this is Paul, a part-time expat, coming to you from the Pacific coast of Costa Rica today, saying so long and see you soon.